Well, when you go into extreme environments, you put your body under stresses that don't exist typically on your terrestrial role. And so you need maximum human performance. And how do we maximize performance? And it's going to be individualized. That's where precision medicine comes in, where you can actually tailor the specific needs of the body based on individual expression of genes, for example, or our metabolomics, and you can maximize the performance and protect the human by knowing the specific needs and the specific countermeasures that may be required. I was either crew surgeon, deputy crew surgeon, ascent surgeon, surgeon that was working the day-to-day missions throughout both shuttle and International Space Station programs. I also served as the lead for the International Space Station medical operations for a number of years. Well, I've never performed surgery in space. We haven't actually done that as a species in terms of a surgical procedure while on orbit. There's been a lot of animal surgery done on space in the animal labs. I've done surgery in the zero-G aircraft, which is a microgravity simulation. And there we operated on a porcine model, a pig, and it was alive, and we took care of a potential kidney stone and how we would manage it on a microgravity type mission. And we were very successful. We used ultrasound for guidance because we didn't have fluoroscopy, and we used flexible scopes like we might use on spaceflight. And so we did demonstrate the capability of performing a surgical procedure in microgravity as would be required for one of the common conditions that happens in space. This is things we debate amongst ourselves, amongst specialists, is that what sort of capabilities do we need to have? I think for low Earth orbit missions or short missions to the lunar surface, we probably don't necessarily have the capability to do surgery on those missions. However, for an extended duration lunar mission, like a lunar habitat, or for missions to Mars, we need to have capability because we know crew members may develop conditions that will require surgical intervention, and we should train the medical officer and probably an assistant on how to do those procedures. It's a lot to train in order to support an exploration class mission, and so there's many factors of preventive medical care, of acute care management, of aerospace specific factors that are unique to the space environment, and then the surgical skills. And it will take a very robust training program, one that we currently don't have, but we're discussing. How do we need to train the space surgeon for the future? When it comes to specific urologic issues, I would say the two most important considerations from, I guess, a genitourinary system in general, as we're talking about, are the potential to develop a kidney stone during a mission. We've had 14 crew members develop kidney stones after flight, and one crew member in the Russian program that developed a stone while in flight. And so we know this is a real risk. And these were all individuals that had been pre-screened to not be kidney stone formers. So this was a unique risk that's associated with spaceflight, and we think it's associated with the unloading of the bone and the bone metabolism that potentially leads to elevated levels of calcium that get excreted in the urine. And so the urologic applications are, number one, to identify those at increased risk, Number two, to try to prevent them with appropriate countermeasures. And then the third thing would be, if you had a stone, how would you manage it? And we've had to manage those at risk, and we had to develop a contingency kit in case they were to develop it. What will we do with specific types of medications, etc. The other application has to do with the differences between men and women when it comes to the genitourinary system. And women, of course, menstruate if they're of a menstrual age and pre-menopausal. And it's not very convenient to have to deal with menstruation while you're on orbit. So many of the crew that are premenstrual take birth control medication, oral contraceptive pills, to prevent the menstrual flow. And as a result, we know that these types of estrogenic agents can predispose a crew member to developing deep vein thrombosis. And that's one of the recent issues that we've had to deal with in a crew member after flight. So this is the differences between men and women are dealing with the differences in physiology and the potential countermeasures that may be used. Yeah. So we have had 5 astronauts that have developed clinically significant prostate cancer. Now, prostate cancer is very common in men, so we don't know that the space flight was somehow a factor in their development. But cancers in general, we've looked at that, and there may be some trends towards an increased risk for crew members. And is that associated with something unique to the microgravity environment and genes that are turned on or turned off? Or is it related to something like the radiation exposure? And we know the crew that went to the moon, the Apollo crew, they went outside the Earth's protective geomagnetosphere, and the geomagnetosphere is what protects us from both solar radiation and galactic cosmic radiation. So it could be that the crew members that went outside the protective geomagnetosphere may have had exposure to radiation that was more dangerous than the radiation that we get commonly here on the planet. And that may have exposed them to added risk as a result of that radiation dose. Well, crews that fly on orbit, they're in these unique environments. Like, for example, they go on a spacewalk. We call it an EVA, extravehicular activity. And that's a little mini spaceship inside of a suit, right? It has got a life support system. It's got potentially some locomotive capability. And the crew members have to survive in that environment that is well outside of their normal performance environment. And with those types of situations, we monitor a number of things. We monitor the oxygen level, the carbon dioxide level, the energy that's left in the backpack, the potential heart rate, and even EKG of the crew members. The crew wears special electrodes so we can track that. If they're under undue stress, we can ask the flight director to lower the workload so that the crew members don't have potential undue physiologic reactions to their tasking and their workload. And so this is the type of monitoring we do remotely, when the crew's in orbit, to try and prevent a medical condition or to prevent some kind of catastrophe associated with failure of the life support system. And when we do these types of things, we learn about human responses to stressful situations that we can apply to terrestrial medicine. So I think that there's a lot of things that we've learned during spaceflight, having to do remote monitoring, having to develop special systems to track crew member health and systems performance that we can apply to terrestrial situations. especially extreme environments. So Agent Orange is a bichlorinated biphenyl. It's a herbicide. It was used to defoliate regions of the jungle so that the enemy, in this case the Viet Cong, would be detectable to U.S. and South Vietnamese forces. However, it is a poison. That's how it kills the plants. And it has toxic effects on human beings too. And we know that a number of the soldiers and the people that were there in Vietnam were exposed to this agent during the war. And it turns out that this particular compound can cause mutations, and it can cause changes in genetic expression of cells. And these changes can lead to things like cancer. And we know that you mentioned prostate cancer, the rate of prostate cancer in veterans exposed to Agent Orange is higher than the general population. And what we're learning is some of those cancers are more aggressive than other cancers. And so these types of compounds, while they may have application that are relevant from a military standpoint, they have human risk that are well beyond and extend much longer than the time frame of the war. And so we have to be very careful about the types of compounds we use when it comes to the exposures of our veterans, our soldiers, and our sailors, airmen.